Botox. You may think it's only for cosmetic reasons, but you couldn't be more wrong. We're getting ready to talk to an ear, nose, and throat doctor about so many more uses. Let's just jump right in. I'm Sarah King, and I have a lot of questions. What exactly happens when you orgasm physically? What can we learn from our poop? You gotta get that protein. Get that protein. Ladies, you need the protein. Do you think it's been exaggerated? If I have sex the night before my pap smear, can it mess up my results? In this show, I get to ask all these questions to WakeMed doctors who happen to know everything about everything. Sarah Has Questions is a production of Capital Broadcasting Company and Mix 101.5. It's presented by WakeMed. We are talking Botox today, and I know I'm about to learn a lot from Dr. Gita Fleischman. She is an ENT, which is an ear, nose, and throat doctor with WakeMed, and she specializes in facial plastics, which includes using Botox. And Dr. Fleischman, first of all, thank you for being here.
Oh, thanks for having me.
I think about housewives with way too much money, way too much time on their hands, and don't make facial expressions. They always just look, oh, that's fine. Yeah. So, is that what you experience in your world of Botox?
Not at all, actually. I think Botox is an amazing tool. It's an amazing medication that can be used to, make faces look less tired, more refreshed. When done right, people shouldn't know that you even had it done.
Oh, if you've done it right, though.
Exactly.
Have you seen some bad Botox in your day?
I think we've all seen bad Botox, whether it's in patients we see or on TV. And sometimes, I look at patients on TV and I'm like, they didn't inject far enough laterally.
I would love to watch a red carpet with you. Oh my God, I'm sure you're like, oh, she had Botox. That's a filler. Okay, well, let's just get into it. What exactly is Botox?
So Botox is basically botulinum toxin. It is a medication that's derived from a toxin or a protein that's, a paralytic agent that's present kind of all around us, but it's made from bacteria.
That paralytic means it paralyzes.
It paralyzes muscle. Mm-hmm.
Okay. So you are literally putting a toxin in your face.
Mm-hmm.
So given that it's a toxin, does it hurt when you inject it? What's an injection feel like?
Yeah, injection just feels like, depending on where it is, but generally on the face, it feels nothing more than a little pinch. Most people tolerate it well. We use very, very tiny needles. So I would say, people say bee sting, but I think way less than a bee sting. And there are other things we can do, like, numb people up if they're just really afraid of needles, or we can use some ice packs to kind of reduce some of the blood flow to the area beforehand to make it more tolerable. You can even use some like vibrotactile devices like buzzy bees or vibrating, little things to kind of just to distract the nerve endings.
When my son gets shots at the pediatrician, she'll put like this little pad that has little pokey things, and there's a hole in the middle of the pokey things, and so he's essentially getting poked everywhere all at once, and then the needle goes in.
Yes.
Yeah, I think that's great. Adults need that. I've never been offered that at any doctor's office, but I want it. So it doesn't hurt, although I have heard some reports it does. Like a friend of mine in our office here, she says that it feels like she feels cracking under the skin whenever she has it done. Have you ever heard that before?
Yeah, and I think what sometimes people feel and sometimes even hear is that kind of tiny needle, but that's kind of piercing the layers of the skin. So I think it's just some people are more sensitive or more attuned to the feel, but I would say the majority of people will not say it is a super uncomfortable thing to do.
Okay, great. How long does an injection last?
Yeah, so the series, like if you're getting it done, probably at one area, whether it's your forehead, your eyes, probably lasts only about 2 to 3 minutes total. But the effect of the medication lasts about 3 to 4 months.
Oh, wow. Mm-hmm. So you could get it done like 3 times a year.
Yeah.
Oh, I thought it was much more recent, like much more frequent rather than that.
No.
And how far does one injection go? Like, because I know I've been... I went to a spa once and I was like, let me check this Botox out. I like the idea of not having as many wrinkles as I do. Let's see what it's about. And she told me just for the worry lines in between my eyebrows, which I've had since I was like in my preteens, she told me something like 25 units. So that's a lot.
Yeah. And, each unit is basically something that you create by adding saline to the vial. So you can, unit is basically a measure, but that doesn't mean that you get 25 injections.
Oh.
Yeah. So basically, we do a pretty customized facial analysis on every patient that comes in.
Okay.
And we basically say, well, how dynamic or how much is your muscle moving? How big is your muscle? How strong is it? And what do you want to change, right? I can do a facial analysis on everybody, but it may not bother that person, right?
Right.
Your concern may be the 11s between your eyes, and we call that
11s.
the 11s. Yeah.
I like that.
And that area is called the glabella, and usually that requires, depending on the the gender, because sometimes males have stronger muscles in the forehead. How if you've ever had Botox before, not anywhere from 12 to about 30 units or so.
Okay.
Just depends. But usually that's only about 4 to 5 areas of injection.
I see. Okay. You've called them the 11s.
Yeah.
Does any other part of your face have fun? Do you have fun names like the around your mouth? Are they called the parentheses?
Yeah. Oh, they are.
Are they really?
Yeah. They are.
Hilarious.
Crow's feet around the eyes.
Okay.
You've probably heard that.
I've heard that
Yeah.
before. I don't mind my
Yeah.
crow's feet, my
Yeah.
laugh lines. I
Yeah.
kind of like those.
Yeah.
All right. So when you go to a spa, they talk about fillers and they talk about Botox. What's the difference between filler and Botox?
Yeah, so there are two completely different sort of medications or products. Botox, like I mentioned, is botulinum. It is an agent that relaxes muscles. It basically, the way it acts is that it tells a nerve ending that usually gives a signal for a muscle to contract or a sweat gland to release sweat. And basically blocks that signal. So areas that would otherwise be dynamic and moving, what Botox does, it basically blocks that handshake from happening.
Got it.
Filler is basically a volumizing agent. It's
Okay.
whether it's hyaluronic acid or some kind of calcium hydroxyapatite. They're basically sort of products that are injected to either fill really deep lines or basically support areas of the face that may have some, volume loss or sagging. So people will put filler in the lips. They may put filler in really deep, very, very etched lines on the forehead.
To lift it,
To
yeah.
lift, yeah.
Oh, interesting. And I hear they never go away. Is this true?
Filler?
The filler.
Filler can be dissolved. So depending on the filler, you can and especially if a filler migrates to an area where you don't want it, you can actually inject agents that completely dissolve it. There are some fillers that don't go away, but majority of fillers, especially the hyaluronic acid-based fillers, do tend to, over time, just dissolve.
I see. So you mentioned a second ago that you can use Botox to stop a gland from firing.
Yeah.
Sweat glands and stop it from sweating. So what are some other things that people might be surprised you can use Botox for?
Oh, yeah. So, I kind of think of starting from head to toe, right?
Sure, let's go.
Yeah. So, the FDA-approved regions cosmetically in the face are basically your horizontal lines in the forehead, the area around your eyes, and basically the 11s, which is your glabella.
Okay.
And that kind of gives a more refreshed look. And then you can kind of go all the way down. Some people like to inject the corners of the mouth from that really kind of frowny face down lines, right?
Okay.
You can also use Botox for people who, clench and grind their teeth, people with bad TMJ.
Oh.
They sometimes have jaw pain, ear pain.
And that's because it's a toxin and it releases the muscles from clenching.
Exactly.
Fascinating.
Yeah, you can also use it in salivary glands like the parotid gland or the submandibular gland. And those are glands that in some people, they drool too much or they produce too much saliva. So you can inject those.
Having a lot of saliva is something I've actually never considered that someone might have, but I guess it does make sense.
Yeah, and sometimes that's used more in children who are maybe neurodevelopmentally delayed. And
That makes
things
sense.
like that. Mhm.
Okay. What else?
Yeah, it's not in my world, but it's used in orthopedics and physical medicine rehab in children with contractures of the hands.
What does that mean exactly?
Yeah, it's like when their hands are sort of twisted and frozen in certain
like somebody
ways.
who has cerebral palsy or something.
Exactly.
Oh, it can release them or just ease it?
It can ease it. It can
Yeah.
ease it, and then used in in urinary incontinence. It can be injected into the bladder. It can be injected into the rectal area.
If you have anal leakage.
Mhm.
Oh, interesting.
Yeah. Mm-hmm.
Gosh, that's fascinating. I do have questions about the sweating thing because I know you can put it in your armpits because a friend of mine had that done. She had excessive sweating. Is it dangerous? Like, I would imagine you need to sweat. What happens to the sweat that you're not releasing?
There's so much surface area on the body that you can sweat out of. It just kind of prevents it from happening at that exact spot.
Oh, so you're going to sweat elsewhere. Maybe like right underneath it. It'll be like a waterfall. Are there side effects to Botox?
I think just a lot of times we talk about side effects at the time of injection. So, a little bit of pain and discomfort. Some people can have some bruising. Occasionally you can have asymmetry, right? If you have a stronger side or a weaker side, or if a
Like
little
a
bit more
drooping eyelid or something?
Yeah, you can have a droopy eyelid if the Botox migrates.
I see.
If you inject around the mouth or inject too much, sometimes you can have difficulty kind of, putting your lips around a straw all the way.
Oh,
Yeah.
well, that would be fun to watch someone
Yes.
have it.
Yeah.
It's mean for me to say that. I'm sorry. Is there anything medically, though, that can go wrong? I mean, it is a toxin.
Yeah, it actually has a very, very safe, very good safety profile. So you would really have to give a very, very, very large amount to the point that most people aren't using for it to have a systemic effect. That said, there are certain people who may have neuromuscular conditions like myasthenia gravis and things like that that we typically wouldn't use it for.
And are there any long-term effects
Of Botox?
of
Yeah.
Botox?
Actually, a good long-term effect is that it makes the muscle weaker. So it actually makes it a lot of times you'd need less and less Botox if you keep up with it over time because the muscle itself atrophies or just kind of flattens out.
So literally your wrinkle irons itself out?
Yes, and you see that really dramatically in the jaw and the TMJ when you start injecting and you are regular with it, the face actually starts to slim because the masseter muscle, which is what you're injecting.
Right, it probably built up.
Yes.
Oh, I never thought about that. Fascinating. I bet you can tell people walking down the street if people have TMJ.
Oh yeah, sometimes they kind of have, we call it the chipmunk jaw a little bit. Yeah.
Is it ever too early to get Botox? Because I know people in their like 20s getting it nowadays, and for cosmetic reasons.
I would, as long as it's an adult and they're able to make their own decisions. I don't think there is a time that it's too early, mainly because it's so preventative. You can start early in your 20s and it actually prevents wrinkles. It's very hard to start Botox, not hard, but it doesn't have the same effect in someone who's starting it after the lines have etched into the face because those are, the skin actually changes.
I see.
So it's actually in some ways better to start early because you just don't develop the strength, the muscles and the skin just doesn't develop the same amount of rigor.
So if you have the money to do so, because I'm assuming that insurance won't cover cosmetic Botox.
It does not.
Which is a bummer. Medical, I would assume it would cover.
It depends. It's a pretty hard flex. Insurance really needs a lot of documentation. There are only a few FDA approved reasons that insurance will cover it.
I see.
A lot of the Botox that's used sort of in the face, it's either off-label use or it's approved but only for cosmetic use.
I see. Okay. Yeah. So let's say this person doesn't have enough money to let's say they're 20 and they're like, I'm beautiful. I want to stay this way. And they Botox themselves up and they hit 30 and they can no longer afford it. So the muscles at that point will kick in, correct?
Of course.
Okay. But they have been atrophied.
A little bit, yeah. And then over time, as you use the muscles more, just like lifting weights, they will build up again.
So it's basically like freezing time. And as soon as you're done with the Botox, time starts ticking again.
Exactly.
I gotcha. Okay.
It is an expensive medication. It's actually a very expensive medication to even buy. And Botox is actually a brand name. It's kind of, and there's no generic right now, but there's different types of botulinum A toxins. So you have Xeomin, you have Jeuveau, you have Daxxify. They're all slightly different proteins, but essentially do the same thing.
Okay.
Some of them are a little bit cheaper than Botox, but Botox, which is a brand name, right? It's trademarked.
Are you paying for the brand?
There's only a slight difference in price between all of them, I would say. But yes, you are kind of paying for the brand because there's no other alternative. And since Botox is it's got the most brand recognition because it was the first one. It's the OG that people they ask for Botox because Botox is the brand name.
Yeah.
But if they ask for Dysport or they ask for Xeomin and that practice provides that those are options that may be slightly cheaper, but overall there's not a massive difference in price.
What about effectiveness?
They're all equally effective. They all have slightly different, nuances. Some tend to diffuse more, spread more.
I see.
Some tend to have a lot longer onset. Some tend to supposedly last a little bit longer. So
That's
you may
the one
have
I
to,
would get.
Exactly, but then they tend to be a little pricier.
Right.
So it's a little bit of a. There's no discounts, I would say. Occasionally you can get discounts if you buy a large amount. That some practices, med spas will maybe give you a few units free here and there, but it's actually quite expensive for a practice to procure. And,
I see.
And then there's the overhead cost of, the needles and syringes and storing it.
Oh, yeah. So do you find like with allergy medicine that some versions of the toxin work better and like some people respond differently to the same brand?
Some people claim that way, and I think the marketing of each drug company will say that ours is better for it's, for sweating, or ours is better for
Right.
salivary glands, because they have to distinguish themselves.
I see.
In my practice, I typically use Botox, which is made by Allergan. So I don't have a lot of experience with those other brands, so I
see.
can't make a direct comparison.
Okay. Wow, I was right. I'm learning so much. I can't believe how much uses for Botox. Like I said, I only thought it was for, the 11s. All right, so we're going to move on now to listener questions.
Okay.
And these are always fun, so I'm going to read these word for word. Quote, I survived a car accident. By the way, I got this off of Reddit. I survived a car accident, a broken back, had leukemia, and this procedure was the most painful 15-minute procedure I have had. And this is getting Botox in hands and feet. Have you heard anything about this?
Generally speaking, the hands and feet are very sensitive.
I was going to say, I feel that that's true. The nerve endings happen. They finish here.
And I don't know if it's as much about the Botox if it's just a matter of the needle going into those areas. Also, the space in the hands and feet is much more tight and much more compact than the face. But I would, in my personal experience, I have not had anyone say it's very painful. Most people will come back every 3 months for more.
Okay. Yeah, because you do have that tree of nerves in your armpit as well. Have you noticed? You're in ear, nose, and throat, so you probably don't deal with that much.
I don't do it frequently. I have done it, but usually we numb up the armpit area.
That would make sense because there's a lot of nerves underneath there. I learned that from people who get a lot of tattoos. We kind of covered this, but how come I hear a cracking kind of sound when I get injections in my forehead?
And again, that's kind of the needle going through the muscles and the fascia and kind of piercing all those layers to get to the good muscle.
Okay. And last question. I was on generic Botox for my migraines and recently made the switch to name brand. My doctor said there's no difference, but I noticed they seem to wear off more quickly than with the generics. Am I imagining this, or have you found this to be true? Again, it feels like we might have covered this already.
We've covered this. Again, probably not a generic, probably a different brand. And, different people sometimes metabolize different brands or different products. It is a different protein a little differently.
Yeah.
And sometimes the units aren't completely equivalent. So 40 units of Botox is not the same as 40 units of, let's say, Dysport or
You
Xeomin.
would imagine it should be standardized.
Yeah, but they're different medications.
Oh.
They're technically different proteins.
Oh, I see. Okay. Yeah. Well, thank you. This was
course.
super informative.
Thank you.
And gosh, 4 times a year, I might be able to budget that in. It might be. It'd be nice to freeze time.
Yes.
That would be great. Thanks so much.
Of course. Thanks for having me.
Finding out that Botox is really for more medical reasons than cosmetic reasons was not the lesson I expected to get from that conversation. Thank you to Dr. Gita Fleischman with Wake Med. For more info on Botox, go to wakemed.org. And if you have a question or an idea for an episode, you can always hit me up in my DMs on Instagram, Sarah Has Questions, or go to WRALFM.com/Sarah Has Questions and leave your idea for an episode there. This is actually the last episode of the season. Thank you so much for listening. We will be back in the fall, and I'll see you then.